Welcome, everyone. Exciting to see how many people are here to hear about the GAO report related to the Evidence Act, given that we've all been immersed in it now for several years. I'm fairly certain everyone gathered here today likely understands the importance of ensuring that decision makers have the best information available when confronting urgent health and social challenges. So let's dive in.
Everybody's approaching the problems from a different lens. We're making really complicated decisions for the American people and businesses every single day, every single minute. Some of them are elected, some of them are appointed, and some of them are program managers that are senior executives. This is a wickedly complex set of things. And that's just like an hour of normal life and how our country operates. Imposing this broader philosophy about evidence-informed policymaking it's not new, but it has gained a lot of steam. So what is the lesson learned? One, and I'm going to give maybe a couple here. We know that evaluation as a field is a transdiscipline. Yes, there are particular places where you can get a degree, but we think about it as a combination of a lot of different things and cross-cutting in government and how we actually implement in a real-time basis. That's kind of like a monumental concept for some agencies and activities because that's not how we structure things in government. We typically will say like, this is your topic, this is your thing. In academia, we say, this is your school, this is your discipline, this is your degree, go forward and prosper. But in evaluation, we actually need all these things to come forward and work together. The Evidence Act was designed intentionally to have multiple things working together, and that was actually sort of revolutionary as a concept in government. The data governance people, the evaluation teams, the statistical agencies. So increasingly, we're using this terminology around an ecosystem for evidence. So why is this a revolutionary insight and lesson? Because it's not how we talk about it. It's not how we operate, it's not how we're designed. And I think increasingly we see some of the audits and performance reviews that are coming out of GAO recognize this, even though they may not use the same terminology. But to your term, the use of culture, or the use of the term culture, I think this is a moment where we've seen that manifestation in government. So this is a pretty phenomenal change. And if I tie it back to the GAO report on capacity assessments, what does that mean? It means that we have not adequately analyzed the capacity and capability of government to do this work because we skipped a whole bunch of people. Some agencies did not include their statistical agencies. We spend $7 billion a year in discretionary funding on federal statistical agencies, and that doesn't even include the 130 units that aren't formal statistical agencies. They should probably be part of that assessment. We have no idea how much we really spend on data governance activities. And when we really get into the weeds on evaluation, we struggle to calculate what that number is. So do the capacity assessments tell us something useful? Absolutely. Do they capture everything? Absolutely not. But think about the big picture. It's getting bigger.
So Melinda, I'd be interested in your views on how far should we go in driving consistency across the agencies through guidance?
Yeah, I read that and I thought, well, okay, I've only worked at one agency, that's HHS, and it is an extraordinarily large agency. It spends $1.7 trillion, has over 85,000 employees, and it's hard for me to imagine standardized guidance even working for that one agency. So again, for me, I think it's more about having, as Rachel said, a priority at the secretary level, and then figuring out how within that agency you're actually going to implement the existing guidance and tailor it to each different program that you are trying to assess or evaluate. And then again, lots of people in the room are probably methodologists as well. And the idea that OMB could issue guidance about what methods to use to evaluate programs that are extraordinarily disparate, I don't think that would be worthwhile. I think thinking about a ranking of different types of evidence that could help people think about how to classify the evidence that they produce, maybe something like that would be useful, but not prescribing how you would generate evidence, what methods to apply to any given situation.
Rachel, did you want to weigh in at all on guidance?
I did because I know that we had some questions as a panel about the role of OMB and potentially including additional guidance on accountability to agencies. And I think that this is where I think that the accountability is on Congress, right? To take what is put forth as evidence-based policy recommendations from agencies and change laws, right? And so I think that that's where we know when it comes on accountability, like I agree with the sentiments here on, that's not OMB's job to write into guidance, agency accountability. I think OMB does that through other, I think that's frankly part of OMB's mission is to help with many different accountability features across the federal government. But I think when it comes to ensuring that we are using evidence to make informed decisions, we need to ensure that policymakers are then taking that data, being armed with it, and then doing something with it, as opposed to looking the other way and not course correcting when the data clearly says to do so or otherwise.
So Erica, what lessons do you think we've learned from this process so far? And how do we go about sharing those lessons and how we approach evidence building? What are the practical steps that we can take to facilitate that sharing? And do you have a candidate for a lesson learned?
Ooh, okay. Well, I think I'm going to lean back on that idea of culture, and that it's through that development of culture that a lot of those lessons learned need to be promulgated, and it's really all about people. Also, I think there's a lot of emphasis, oftentimes in maybe GAO reports specifically, or in guidance document, all around creating systems, and kind of this idea that if you can create a system around something, you bake it in, and it sort of lives beyond itself. And I think that is can be helpful, but I think if you don't have the people and if you don't have the culture around those systems, you're still not going to get very far. So, I do think that so far the best ways that I've seen, good things spread is through the people that are working on these issues. I think we all know how unlikely it is a piece of paper that gets published somewhere is, how unlikely it is that that's going to change much of anything without people taking that up, taking those ideas and then championing them and carrying them forward. And so I think that's something that we need to really focus on, is continuing to identify how we can work with and through people to get these ideas moving and continuing to spread forward.